in medicine, not all memory loss is Alzheimer's, and not all Alzheimer's is Alzheimer's. When I was in training, what I was taught was Alzheimer's disease is very rare, and by definition, it cannot occur in anybody over the age of 55. That's what Louis Alzheimer said when he first described the disease. It could also be called presenile dementia. It also called dementia precox. In other words, all those names were used in the medical literature. And then over 55, you had to use the term senile dementia, not presenile dementia. So a lot of what today is called Alzheimer's disease is actually what scientifically should be referred to as Alzheimer's senile dementia of the Alzheimer's type. It's not real Alzheimer's. But today the terms are used interchangeably. But there's other memory losses, such as age-related cognitive decline, and I'm still trying to figure out what that is. Mild cognitive impairment, which in my practice today, which is a very eclectic practice of integrative medicine, memory issues and brain fog are the third commonest complaint that I hear, past fatigue and aches and pains. The third thing I hear is memory problems, and we're now hearing it in teenagers. We recently had 2 people in their 20s have strokes. And of course, when you have a stroke, you go right to the emergency room and the machine jumps all over you. And what they're doing is looking for something to operate on. You know, they're looking for the neck arteries or whatever. And they didn't find anything. And when we ran circulation testing on them, they both had advanced microvascular disease in their brain. And this is in their 20s. We recently had a 15-year-old where we did circulation testing on her, and she had microvascular disease in her brain. So this is an epidemic problem. And the system is not dealing with it. They're not understanding what's going on. But the various things, there's these other syndromes they get, Pick syndrome, Lewy body dementia, Huntington's disease, supranuclear palsy. There's a whole bunch of them, but there's no treatment specifically for them. If you go to these folks and say, if you're diagnosed with Pick's or Lewy body or Huntington's, how can they treat it? Nothing. They can't do anything. What difference does it make what you call it? At least that's in my world. But people that come to see me, all I'm interested in, are they having cognitive or memory problems? I don't care about the label that's being put on it. Now, potential causes of memory loss, because this is going to come back to how the system and how I treat them. And again, we're back to a language problem. What do you mean by cause? Because if you go back to Aristotle, who was the Macedonian genius that defined what cause means in Western thinking, Aristotle said there are 4 causes to anything. There's a material cause, a formal cause, a final cause, and an occasional cause. So what kind of cause are we talking about here? And we're now back into the language problem here. But that aside, specific causes you can say that lead to noetic memory loss today are neurotransmitter loss, and this is mainly what the establishment is looking at with the drugs that they use. They're cycling around the enzyme acetylcholine esterase, and they're cycling around glutamic acid toxicity, monosodium glutamate, and that's what the drugs do. But there's other causes. There are structural causes. For instance, you can have the neurofibrillatory tangles that supposedly are specific for Alzheimer's, but have now been described in heart patients who have no memory loss, and that's supposed to be specific for Alzheimer's disease. You can have a subdural hematoma. You can have all kinds of structural problems. You can have a brain tumor. There's genetic problems, and my argument with scientific medicine saying something is genetic is, if you understand how genetics work, a gene for something is a potential, but the environment has to act on the gene for it to manifest. So when someone says it's genetic, to me it's like a scientific cop-out, because something in the environment has to activate the gene. Otherwise it doesn't manifest. So you can say people have genetic tendencies to Alzheimer's. This is a big field. It's a big field in research, which is about money. But there's no treatments, and that's what they're doing. They're looking for the pot of gold at the end of the rainbow. They're looking for the patent of the drug or the procedure that they can patent. But there's other causes of memory loss. There's toxic causes, for instance, gluten sensitivity, lead, mercury. There's nutritional, vitamin B12, folic acid, vitamin D. There's hormonal. Ask any woman that goes through menopause about the brain fog that they experience. Males that go through andropause, also testosterone has shown that. Look at hypothyroid people. They have memory problems. There's immune problems, and that kind of crosses over to the infectious problems. And there's other infectious and immune problems. AIDS patients get dementia. People that are put on these immunosuppressive drugs for rheumatoid arthritis or Crohn's disease and stuff, in the TV ads, the rapid talking about, it can kill you, bankrupt you, everything at the end. These things can activate viruses in the body.